Carrier screening is testing that can be done to see if you or your baby's father has a change in a gene that would increase the chance for the baby to have a serious genetic disorder. Carrier screening can be done at any time, but can be most useful if it is done as early as possible in pregnancy or even before starting a pregnancy. There are several factors to consider when deciding if you want this type of testing. They include how common the disorder is, how severe the disorder may be in an affected child, and whether prenatal diagnosis is something you would consider. Expanded carrier screening, which may also be referred to as a panel, uses one blood sample to screen for many different disorders at the same time. Expanded carrier screening may include testing for a few disorders or many, depending on the panel. These panels typically provide carrier screening for more common genetic disorders, such as cystic fibrosis, spinal muscular atrophy, Fragile X syndrome, and severe inherited anemias. Many panels also include testing for other serious disorders that may result in a child having intellectual disability, formerly called mental retardation, lifelong or progressive illness, severe disability, or a shortened lifespan. Some of the diseases may be treatable. For others, there may be little treatment. Some disorders are more common in certain ethnic groups, and some occur about as often in people of all backgrounds. You may want to consider expanded carrier screening if you want the most information you can obtain about your risk for having a child with a genetic disorder. The test results from a carrier screening will identify if a person is a carrier for any of the genetic disorders on the panel. A carrier is a person who has one working copy of a particular gene and one altered copy. The change in the altered gene is generally referred to as a mutation. For autosomal recessive disorders like cystic fibrosis and sickle cell anemia, if both parents carry a mutation in the gene for the same disorder, there is a chance that each parent will pass down the mutation in the gene to their baby. If a baby receives both mutations, one copy from the mother and one copy from the father, the baby will have the disorder. The chance for this to happen is 25%, or 1 in 4 with each pregnancy. Less common are X-linked recessive disorders, where carrier women have a 1 in 4 chance to have an affected son. Expanded carrier screening does not test for all genetic disorders and is not able to detect all carriers of a mutation. However, if you or the baby's father has a negative test result, it means that no mutations for genes on the panel were detected. A negative result reduces your chance to be a carrier, but it cannot completely take away the possibility. If you have a positive result, it means that a mutation was detected and you are a carrier for a specific genetic disorder on the panel. Some people are carriers for more than one genetic disorder. If you learn that you or the baby's father is a carrier, you should talk to your doctor or genetic counselor about your results and the recommended follow-up testing. If you and the baby's father are found to be at an increased risk to have an affected child, prenatal diagnosis by amniocentesis or chorionic villus sampling is available to find out if your baby is affected. If you are found to be at an increased risk and thinking about becoming pregnant, you should discuss other available options with your doctor or genetic counselor. Keep in mind that all tests discussed here are optional, and all decisions about carrier testing are entirely up to you. As you consider your testing options, remember that most pregnancies result in a healthy baby. But no test is perfect, and no test can check for everything. Talk with your doctor or genetic counselor about your testing options and any concerns you have. We hope that by understanding what tests are available, you'll feel confident that the test you choose is right for you and your family.